Unit 14. Symptoms and Signs. Exercise 14.1. Complete a table with the words from C opposite, with a stress mark in front of the stress syllable in each word. The first one has been done for you. Exhaustion. Adjective, exhausted. Noun, fatigue. Adjective, fatigued. Noun, lethargic. Adjective, lethargic. Noun, tiredness. Adjective, tired. Exercise 14.2. Make words combination using a word from each box. Look at A, B, and C opposite to help you. Complain of color, out of sorts, present with, put on, worn out. Exercise 14.3. Complete the sentences with the correct form of the verb present. 1. A 67-year-old man presented with a 9-month history of increasing shortness of breath. 2. The most common presentation is loss of consciousness. 3. Chronic arthritis may present as fever without any obvious causes. 4. The patient usually presents with a severe sore throat. 5. The presenting symptoms in this patient could perhaps be due to renal failure. 6. Other conditions with a similar presentation include acute cholecystitis. 7. Reduced growth is an important presenting complaint of celiac disease. 8. 2 months following presentations, the patient was able to walk. 14.4. Read the patient's description of her symptoms, then complete the case report. Look at C opposite to help you. It says, I was well until a few months ago. In the beginning, I just felt off-colored and a bit tired. But lately, I've been feeling completely worn out at the end of the day. I am not eating any more than usual, but I've put on 9 kilos in the last year. My emotions are hard and my hair was started to fall out. K13. A 50-year-old housewife who had been well until 4 months previously complained of tiredness and malaise. She had gained 9 kilos in weight into the year before to present to her GP, although she denied eating more than usual. She was constipated and she noticed that her hair had started to fall out. Unit, Unit 15, Blood. Exercise 15.1. Find words in the box with opposite meanings. Look at B and C opposite to help you. Adequate, inadequate. Unlikely, likely. Mild, severe. Common, uncommon, or rare. Insidious, sudden. Against, for. 15.2. Make word combinations using a word from each box. Look at B and C opposite to help you. Bone marrow, differential diagnosis, insidious onset, iron deficiency, pernicious anemia, progressively sense, vibration, progressive, progressive increasing, vibration sense. 15.3. Complete the sentences, look at A, B, and C opposite to help you. After 39 years old man presented with a history of progressive abdominal distension over a period of 6 months. 2. Blindness may be caused by vitamin A deficiency. 3. The bleeding and purpura are caused by abnormal platellar function. 4. The white cell count is abnormal, so we can which is normal, so we can exclude acute leukemia. 5. The yellow color of her skin and conjunctive is probably due to the jaundice. There was a palpable mass in the right upper quadrant of the abdomen. Treatment is treatment is aimed at restoring fluid balance with adequate intravenous fluids. 8. The anemia may be due to increased red cells breakdown. 15.4. Complete the conversation. Look at C opposite to help you. Professor says, what is against the diagnosis of pernicious anemia on physical examination? The student says, the problem started quite suddenly, so it didn't have the typical insidious onset. He doesn't have any skin pallor, and he doesn't have symmetrical paresthesis or absent vibration sense. And I couldn't feel his spleen. Professor, what about his tongue? The student says his tongue was normal and not inflamed or sore. Units 16, the bones. 16.1. Label the diagram using words from each box. Look at A opposite to help you. 1. Skull. 2. Jawbone. Jawbone. 3. Spine. 4. Breastbone. 5. Rib. 6. Collarbone. 7. Shoulder bone. 8. Thigh bone. 9. Kneecap. 10. Shin bone. 62. Match the types of fracture with the descriptions. Look at B opposite to help you. 1. Open. A. There's a break in the skin. 2. Community. C. The bone is broken into several pieces. 3. Displaced. D. The broken pieces are separated. 4. Green stick. B. The bone is bent. It occurs mainly in children. And 5. Impacted. E. The broken pieces are pushed together. 16.3. Complete the textbook extract. Look at the opposite to help you. Reducing a fracture involves trying to return the bones to as near to their original position as possible. If a fracture is allowed to heal in a displaced position, the fracture will unit, unit, but it may go on to malum. malum. Unit 17. Childhood. 17.1. Complete the table with the words from A and C opposites. Birth. Delay. Non-delay. Adjective delayed. Develop. Development. Distant. Distension. Distant. Fail. Failure. Failing. Nourish. Nourishment. Nourished. 1. Babies with the fetal alcohol syndrome may present with failure to thrive. Abdominal distension may be due in an enlarged liver. Small amounts of alcohol in pregnancy can affect fetal development. Mortality from measles can be reduced by better nutrition. Delay in one or more of the milestones may be the first sign of disease. 17.2. Complete the sentence. Look at C and B. Look at A and C opposites to help you. After sitting, babies learn to crawl and then to walk. A child who has started eating solid food has been weaned. Someone who is not very tall is said to be short statured. The stage is the the stages in a child's development are known as milestones. A child who is beginning to develop sexuality has reached puberty. 17.3. Write the common English name for each disease using the medical knowledge. Enlarged parotid glands, mumps. Difficulty opening the mouth, lockjaw. rash in a large posterior occipital nose, German males, paroxysmal cough with vomiting, whooping cough, papules and vesicles pierced on throat, chickenpox, cough and cold followed the rash, measles, sore throat of rash, scarlet fever, scarlet fever, swollen joints, and a heart murmur, rheumatic fever, fever followed by muscle weakness, polio, cough with stridor, croup. Unit 18, the endocrine system. Complete the table with the words from A, B, and C opposites and related forms. Put a stress mark in front of the stress syllable in each word. Verb inhibit, non-inhibition, produce, production, release, released, replace, replacement, secrete, secretion, stimulate, stimulation. 18.2. Complete the passage from a textbook using the illustration and words on knowledge. Pulse of GnRH, gonadotropin releasing hormone, are released from the hypothalamus and stimulate LH and FSH, released from the pituitary. LH stimulates testosterone production from leading cells of the testes. Testosterone feels back on the hypothalamus pituitary to inhibit GnRH secretion. FSH stimulated the Sertoli cells in the seminiferous tubules to produce mature sperm, and the inhibins A and B inhibin cause feedback in the pituitary to decrease FSH secretion. 18.3. Complete the sentences. Look at A and C opposite to help you. A diffuse change affects many parts of an organ or gland. 2. Localized change affects only one part. His diet, his diet is different in iron. He doesn't get enough iron. 3. Exists T3 and T4 increase the basal metabolic rate. 18.4. Match the daily symptoms 1 to 7 with the questions her doctor asked. A for A to G. Look at D opposite to help you. Diarrhea. D. Are your bowels normal? Eating more. What is your appetite like? Heat intolerance. Do you prefer hot weather or cold? Overacity. Are you able to sit and relax? Palpitations. Have you ever felt your heart beating rapidly or irregularly? Weight loss. Is your weight steady? Three more. Do your hands shake? Unit 19. The eye. 19.1. Complete the table with words from the opposite related forms. Verb, noun, and adjective. Accommodate, accommodation, accommodated. Constrict, constriction, constricted. Converge, convergence, convergence, convergent. Dilate, dilatation, dilatation, dilated. Droop, dropping. Oscillate, oscillation, oscillated. Read, reaction, reactive. Match pictures with the conditions. Dropping dropping of lips is the sixth picture. Dilated pupils is the third picture. Irregular pupil is the second picture. Cataract is the fifth picture. Squint is the first picture. Constrictor pupils is the fourth picture. 19.3. Complete the extract from a textbook. Look at C opposite to help you. Examine the retina and with an ophthalmoscope, if it's possible with the pupil dilated to obtain maximum view. Look out for the papilloedema for flame-shaped hemorrhages and continual sourness. assess the state of arteries and note the presence of any narrowing as well as nipping at arteriovenous crossings. Unit 20, the gastrointestinal system. Complete the report. Look at 8 opposite to help you. 1. Distant. 2. Tenderness. 3. Quadrant. 4. Guarding. 5. Rigidity. Unit 12. That 2. Match the description the stools with the conditions most likely to cause them, using your medical knowledge. Type of stools, condition. Loose, bloody. C. Ulcerative colitis. Loose, pale, bulky. E. Celiac disease. Clay colored. F. Astropic jaundice. Jaundice. Black terry. A. Gastric ulcer. Small heart. B. Irritable bowel syndrome. Clear, watery with mucus. D. Cholera. Match three. Match the features. The doctor's questions. F. Sorry. 1. Blood. Is the F. Have you passed black stools? Bowel habit. A. How often do you open your bowels? Change in bowel habit. B. Are you going to the toilet more often than normal? Bulk. G. Is the size of the amount of the stool normal? 5. Color. E. What about the appearance of the stools? 6. Consistency. C. Are the motions hard or loose? Offensiveness. D. Do the motions have an unusual smell? Unit 21. Gynecology. Write a simple English phrase for each of the medical terms below using your medical knowledge. Hysterectomy, removal of the womb. Menorrhagia, menorrhagia, heavy periods. Salpingitis, inflammation of one of the tubes that connects the ovary to the womb. Cervical biopsy, biopsy of the neck of the womb or cervix. With the conversation between the gynecologist and the patient in C opposite and complete the notes about the patient. Menarche, 12 years. Menstrual cycle, 45-28. LMP, 252 ago. AHDO. Menorrhagia, no. Dysmenorrhea, no. Discharge, a little white discharge in between periods. Now, what are the questions that the doctor asks and look at C opposite to help me. Minarch, how old were you when you started your period? Menstrual cycle. Are your periods regular? LMP. When was your last period? Menorrhagia. Would you say they are light heavy? Do you get clots? Dysmenorrhea. Do you get period pains? Is there any discharge between the periods? What the color is it? Complete the case report. One more is needed twice. Look at B and C opposite to help you. 1. Prolong. 2. Close. 3. Periods. 4. Periods. 5. Flushes. 6. Oral. 7. Pill. 8. Coil. Unit 22. The hair and circulation. 1. Complete the conversation based in a history in B opposite. Doctor says, what seems to be the problem? Patient says, I've been getting palpitations. How long have you had them? For about 6 months. but I had heart problems for years, with tiredness and shortness of breath. In the end, I couldn't walk more than 100 meters without having to stop. I had to sleep in three pillows. I had mitral valve replacement 3 years ago, and improvement things for a while. 22. 2. Make word combinations using a word from each box. Two words can be used twice. Look at B and C opposite to help you. At rest, atrial fibrillation, cardiac failure, cardiac output, heart, edema, on effort, breathing edema, premature failure. Write the words patient could use to describe the symptoms below. Dyspnea, breathlessness, arrhythmia, palpitations, orthopnea, breathlessness when lying flat, edema, swelling. Complete the case report. 1. Effort. 2. Episodes. 3. Palpitations. 4. Shortness. 5. Swelling. Unit 23. The heart and circulation 3. 23. Complete the table with the words from A opposite. Verb, noun. Auscultate, auscultation. Examine, examination. Inspect, inspection. Palpate, palpitation. Percuss, percussion. 23. Put the steps for examining the heart and circulation in order according to the four-stage system. A. Measure the heart size. Percussion 5. Are, are there any movements? Auscultation 6. Feel the radial pulse. Palpitations 2. Look for clubbing. Inspection 1. Locate the apex beat. Palpitation 3. Note any thrills. Palpitations 4. 23.3. A doctor is presenting the case of a 43 years old woman admitting in the cardiology department. Complete the text of her presentation. 1. Force. 2. Pulses. 3. Central. 4. Peri- peripheral cyanosis. 5. Apex beat. 6. Intercostal space. 7. Mid-diastolic murmurs. 8. Friction rub. Unit 24. Infections. Match two parts of the sentence. Look at A, B, and C opposite to help you. 1988 saw the UK launch of Live at Tunnel. J. Measles, mumps, and rubella. Chickenpox in common infections. E. Disease of childhood. Rabies and incubation period ranging from the days and many months. The patient remained febrile. Age with peaks of temperatures of 39 that 5 Celsius. He has admitted with a 4-day history of influenza-type symptoms of fever with rigors, malaria, and general malaise. Quite a proportion of patients who recover from hepatitis B become carriers of the virus. The central part of Africa in the midst of an epidemic. F. For AIDS, AIDS. Measles rubella is most a period rain period ranging from 4 days to many months. Lyme disease is caused by transmission of B. Burgdorferi from animal to man by exotic ticks. PUO stands for pyrexia of unknown origin. 24.2. Complete the case report on a patient in A opposite. 1. Fevers. 2. Rigors. 3. Incubation. 4. Prophylaxis. 5. Parasites. 24. 3. Complete the sentences, look at A, B, and C opposite to help you. In an infection which can be treated successfully with antibiotics is curable. Another word for epidemic is outbreak. Bacteria and viruses are examples of microorganisms. Someone whose temperature is normal, febrile. The common infection with Epstein-Barr virus is known as glandular fever.